That is in the about 20 days before her death. That is in the 9th month. Now, mother stayed back to help her because she was already 8.5 months pregnant and very, very weak. She then went to meet this private doctor who gave her an injection, who knows what, prescribed a tonic, told her to come back to the hospital for a checkup, and advised her to have an institutional delivery, and said that you're far too weak, you can't do this, you shouldn't do this like you've done all of your others at home. But she didn't go back to this doctor, nor did she buy the tonic that he prescribed, because she didn't have the money for it. And then we know what happened in the period just before, died maybe 2 days before. But she kept on, and no one in the family or anywhere else really got her or paid attention in order to take her. And this is after significant antenatal checkups. The Asha is present in the village. The A&M has seen her, and all sorts of things have happened. Finally, the Sulgiti, as the dai is called in that part of the country, was called, and beginning to dilate, but she was so weak she was unable to push, and so the dai herself said, no, can't do it here, better take her to the hospital. What happened when she got to the PHC in Kuknur is that she was told, she met the doctor, but he was running out. And he was running out for the pulse polio program. And as it turned out, in the next day and a half or so, she could see practically nobody because everybody was busy with the pulse polio program. There was only one place where the staff nurse was there, and she was told to go there, and that staff nurse was overburdened with so many people that she got very little attention. She called the 108 ambulance, which works quite well, reasonably well, or at least used to work reasonably well, in its first 6 months or so, in terms, I mean, the 20-minute turnaround of the 108 ambulance to get women into facilities actually worked reasonably well. But more and more we keep hearing about delays in the coming of the ambulance, because the ambulance is now overburdened. There's just too much of a load on the system. So when they called the ambulance, it took the ambulance more than an hour to get there. Fetal movements started getting very weak. There was, and probably there was a fetus leading then to maternal exhaustion. Basically, that was the cause of her death. Now, if we look at why this woman died, and what is it that happened or went wrong in the system in the way that she did, I think it tells us so many things about the failures. It tells us many things not only about how society is, but how the system works or doesn't work, in fact. And in all of the time that I spend on various, meetings of the government with this and that and so on, the attempt to get them to actually don't look at numbers, please look at cases. Please see what is actually happening on the ground. Don't make assumptions about what is going on with your JSY and this and that and institutional deliveries and what have you. You need to know what is really being faced and how your system is actually working or not working on the ground. We know that there were a lot of injustices in her thing where gender inequalities played a huge role. Some preference, the struggles over safe abortion. The doctor is giving her pills, but there is no sign in a system which is where they are supposed to be able to do MTPs, and where this is a woman who would have been absolutely met all criteria to have a safe termination of pregnancy, came early. enough in the first trimester to get it done, couldn't get one, even though she wanted it. The unintended pregnancy, and of course this whole business with the husband and the family, and the callousness with which actually they treated her. But our concerns here, as much as we are, as we have to focus on that, is really to look at where system failures happened. The first system failure was clearly the treatment of abortion itself. Safe abortion is our guarantee in conditions like this in this country, but it's not working. And it's working less and less now, even as we are talking more and more about maternal mortality. And I think this was failure number one. Failure number two, the system had no way of really seriously addressing her anemia. The signs of anemia and severe anemia were clear from very, very early on. And yet, all they're giving her are those wretched IFA tablets, which everybody knows by now. Nobody takes because of the side effects and problems that they have. And in any case, for severe anemia, those IFA tablets are not going to do anything for you. Now in the system, we are seeing talk about iron sucrose injections, and we are pushing hard, saying if you have to do transfusions. If you have HB4 and HB5, which we often find, you are, there's nothing you can do short of really tackling it seriously. But there was practically nothing. The ability to even identify risk. In our work in Koppal, it's very common and very standard to even have doctors say, if you formally give them a set of symptoms, including swelling and so on, and say, what would you do in this case? They will tell you, yes, we would classify this as a risky case. But if you don't ask them that formally and look at how they actually practice, most of it is, everybody has it. Swelling is very common. Don't, just go on. Forget about it. You can't do anything about it. Now, if you're a doctor in a PHC in Koppal and 70% of the women who are coming to see you are like that, either because they're too young and it's an early pregnancy, so it could be a sign of preeclampsia, or because you're anemic and it's coming because of that. That's a very large proportion, and one can see that it would be difficult for the staff to know how to handle it. But the system has to handle that. We cannot pretend that women in these parts of the country are like you and me. These are not middle-class urban women with a level of nutrition and so on that you can treat in that way. If that is not part of your basic protocol for your standard operating procedures, then your system is not going to work for these people. And that is exactly the kind of thing that we are finding. And then, of course, the pulse polio issue. The entire staff disappears to do pulse polio. Now, we are not arguing against polio immunization here, but surely, where is the way in which the system is working in order to make sure that these things do or do not happen? As I said, human rights violations occur in Koppal today, despite the NRHM, despite 108, despite GSY, despite the presence of the ASHAs, and despite the fact, importantly, that in this small district, physical distance per se from the health center is not a problem. All of the deaths that are happening are of women who have gone for checkups multiple times and increasingly are actually dying in the facilities or between one facility and the other. It's not because they were so far away that, in the dark and the middle of the night they're bleeding and then they don't get to the facility. That's not what is going on.